Hey, Dr. Simone and I are here to have a chat about bumps, cuts, concussions, all sorts of fun things that happen to your children intentionally, and sometimes not intentionally. But what, as a parent, can we do to, I guess, reduce the anxiety that happens with bumps, cuts, concussions, anything like that?
So invariably, if
Yes.
you have a child
what should we do?
is an inquisitive child who likes going to the park and running around and playing, they're going to hurt themselves at some point in time, be that a scraped knee, be that a split chin, be that whatever.
Ooh.
And so the key thing that I think that we can do as parents is anticipate that this may happen and be prepared. So I have a really good first aid kit.
Okay.
So get set up at home with a really good first aid kit that has dressings and some disinfectant, has some bandages, has the things that you go, I wish I had that.
Right.
When you're in that situation.
Okay, so carry it around. They sell some that are just...
You can get little tiny ones for the
travel
pram,
bags,
you can get ones for the car. Knowing that you've got that can help you to be prepared.
Yes.
If there is... So the other thing that I think is really important is that kids will feed, at the time of an injury, a child will feed off of our emotion. And so if we see blood and faint, that's not going to be a good situation.
Because it's scary for a parent.
It was scary for a
Especially
parent, it's scary for a
parent.
kid, absolutely. Right. So as much as you possibly can, try and stay calm in the moment. You can freak out later. It's perfectly fine to freak out later, but right then your kid needs you to be calm. So that's what you need to try and be as much as possible. If someone's cut themselves, give it a clean, wash it with some water. If you've got some antiseptic, use that too. But keep it clean, and then if it's an easy cut to put back together with a bandage while you're going and getting it checked out, wrap a bandage around it and hold it together.
Okay.
If something is bleeding, clean it, press on it.
Okay.
Some pressure with like a towel, or if you've got some, gauze bandages or something like that, will be really helpful in terms of stopping the bleeding, and blood freaks kids out as well.
Yeah.
So minimising the things that are going to distress them. If you're unfortunate enough to break a bone or something like that.
So often like babies will fall, hit their head.
So those are the sorts of things where you need to, did they blank them? Did they black out? Did they lose consciousness, or did they just cry straight away and then get up and get on with doing what they were doing?
When should we go to emergency or take our children to the doctors?
If your child has bumped their head and then they have either blacked out or vomited, or you notice that they're losing like a little bit of fluid out of their nose or their ears, those are the things that can indicate that it has been a bit of a more serious head injury, and you need to get that seen to straight away.
Thanks so much, Dr. Simone, for those awesome tips. I hope that's helped you when it comes to bumps, cuts, concussions. Don't ever hesitate to take your child to the doctor if need be.